I want to thank Chairman Moran and Senator Tester for having the hearing. I can't imagine anything more important than about increasing the quality of care, maintaining the quality of care that we have, and again, going forward, and then also access to care, which is really what this is all about. So I know that we've had a really significant backlog in regarding reimbursement in the past. VA's worked hard to get that down. General, recognizing that the Mission Act changed the reimbursement plan for providers, placing a heavier burden on TPAs like OptumServe up front, can you provide the committee an update on how the VA is reimbursing you for care to community care providers in your network, and are there any challenges that you're facing that we can be helpful with?
Yeah, thank you so much,
I think
Senator.
that's really the bottom line. You know, you're not going to have your providers if they don't get paid.
Could not agree more. And prior to launching the 3 regions, one of the significant areas of getting providers into the network was because of the challenges of the past. I can report to you today that I think we're in a very good place. We are paying providers first, which is a change, and we're paying them 11.9 days, almost 99% of the time. And then the VA is actually reimbursing us around 7 days. So that system is working right now, and we keep a very close eye on it because it is how we retain high-quality providers.
Mm-hmm. Very good. Again, Optum now is in Arkansas and has taken over, which is, again, is great. There's concern about people that are under other providers that have had, a long-term relationship with them. For a veteran whose current provider is not in the network, what does this transition look like? How can you help provide continuous care for veterans under these circumstances?
Thank you, Senator, for that question. Continuity of care, which we both know is so very, very important, and healthcare is a very personal relationship with your provider. One of the things that we've done is we've actually asked the VA to prospectively identify those individuals that do have a relationship, that there's ongoing authorizations, and then the analysis to see whether or not there is a gap in the provider being in our network. And then where there is, we can look to evaluate, does that provider meet the new standards of being a fully credentialed provider? Meeting all those standards, then we're able to bring them into the network. And so when we meet every single month with 109 VAMCs, we actually talk about gaps in care. We talk about where they need us. We talk about veterans' concerns. And so that's another place where that can come in. And then actually the VA has given us their priority providers as well for us to bring those into the network.
Mm-hmm. Very good. We understand that it takes time to build community care networks to best serve veterans. Based on your testimony, General, it appears that OptumServe has been able to quickly create a network that serves almost all veterans in Region 3, and that's very commendable. You stated that for Region 3, 95% of veterans are able to reach an in-network urgent care facility within a 30-minute average drive time. This is partially a credit to OptumServe's ability to efficiently accredit healthcare providers as part of your network. In terms of the process, what's the average timeline for a healthcare provider to receive accreditation by OptumServe? Is this something that can be improved on? Is there anything that we can do as a committee to help in that regard?
So thank you, Senator. Early on, when we were first standing up Region 1, we had a challenge in that area because we were bringing on hundreds of thousands of providers, and so it really was a large volume going through our system. We're now in a much better shape, having fully operationalized Region 1, 2, and 3. So our averages are between 5 to 15 days. Sometimes there's some specialty like visions that may take a little bit, 20 to 30 days. But that process is actually working extremely well right now. So I don't think there's any assistance that we need from Congress.
Okay. Thank you very much.